And we're talking about children, we're talking about the coronavirus and what we know so far. And we started this interview by saying that everything we're saying today, and this is a disclaimer, is what we know as it stands right till this minute. So things are still developing with this virus. There will be new information tomorrow, and we're here to really separate fact from fiction and answer your questions. We got a question that said, Dr. Sharara, how long after recovery is it possible to reintegrate yourself into society?
So the recommendation now is 14 days. But again, some people are saying that maybe you still shed the virus for another 2 weeks after that.
Okay.
But you know, you cannot, it's very hard from all standpoints to isolate someone for an entire month.
Do you think, so this brings me to the question, how long do we have to be quarantined for, you estimate, in Lebanon?
I don't know. Yeah, I cannot tell you what you know, I cannot tell you the exact number, but all I can tell you is that we are very happy so far. You know, we don't want to, one of my math teachers used to tell me when I was in school, Sharara, don't smile until you finish the entire test. So I don't want to smile even at our curve, but with the social distancing that has been applied, with the schools having closed really early, I think so far we are doing well. Okay, so people need to continue to stay vigilant, to continue to apply social distancing until we really start to see no increase in new cases, until we really start to see that curve being flattened.
We need to talk about this curve, society, and panic. And what we, let's talk about what we really need to know here. Too much panic. You and I got to talk a little bit before this. You told me too much panic is bad and too little is bad. So you need the right amount of panic where, you understand that it's important to stay at home because we need to flatten this curve. And explain to our viewers and to our audience today what that means exactly.
Okay. So the reason why I said that a little bit of panic is good, because nonchalance is also bad. So if we say that, come on, this is a regular flu, we are fine, then people will not go into social distancing. People will not apply all the precautions that they need to apply. So people need to be a little scared. And I think this is the exact state that we are in Lebanon right now. People are a little scared. Some people are scared more than others, but I think we are in a good state right now. So what does flattening the curve mean? Actually, the term flattening the curve is an epidemiological term. So it comes from statistics, from studying the previous pandemics that have happened in the past, namely the 1918 Spanish flu. But flattening the curve means slowing down the virus spread so that the healthcare system can deal with all the cases. So we know that a certain number of people will get infected. So when your curve is really very steep, so you have a steep rise and a steep fall. The numbers start to fall when the all possible number of people get infected. That's when the curve starts to fall again. So if we apply social distancing, instead of having hundreds of people getting the infection daily,
and hospitals aren't able to handle it. Hospitals, right?
Rushing to the ICUs, then some people will not get the healthcare they provided.
Right.
So think of this analogy. Let's say you are at work, okay, and you cannot go to the bathroom the entire day. You have 1 hour for all the employees to rush to the bathroom, okay, and you have 2 toilet seats, and you have, 200 employees. It's gonna be a mess. If you do not apply restrictions on the time people are going to the bathroom, then people can use the bathroom all day long with no problem, okay? And they can just wait for each other a little bit. So I think people might understand if we use this analogy. Flattening the curve doesn't mean getting less infections. It's just the infections are spread over a longer time so that hospitals can deal with it.
And Dr. Sharara, how, because I know, it's very, very sad and really alarming when you see what's happening in Italy. And, where today, 475 deaths in one day. The biggest and highest death toll of any country so far in one day. They're unable to take in all these patients. It's kind of alarming because they have to choose who to let live and who to let die. The United States still predicting that there's going to be a huge outbreak, and the healthcare system is not ready for that. What is the situation in Lebanon today?
So, the situation in Italy is really heartbreaking, and we all feel heartbroken, actually. My husband and I are both intensive care physicians, and we are part of some international groups that discuss how the care is being provided in different countries. And I can tell you that in Italy, things are really, really sad. I really feel sad for them. I'm not exactly sure what went wrong in Italy, but I can tell you that the measures were not taken early enough. Social distancing was not done early enough. Schools were not closed early enough.
I think it got out of hand for them.
Panic.
Right.
Yeah,
right.
they did not panic early enough. The same trend, unfortunately, is happening in Spain. I don't know if it's as severe as the one in Italy, and people expect the US actually to be almost the same.
Yeah.
So in Lebanon, there was actually a curve published by the Global Health Institute at AUB that showed that so far we have been able, I don't want to say to flatten the curve, but I would say to curb the rise. So the numbers are certainly not rising exponentially. When we say exponentially, it means that the new cases are doubling every day. And in Lebanon, they have not been doubling every day. Okay, so we had 13 new cases today. We had 11 new cases yesterday. We had 11 new cases the day before.
Doctor, could there be cases that are not being registered? I mean, cases that are not going into the hospital? Because we hear about cases where they're sending people home. They're telling them, listen, you're showing mild symptoms, just go and quarantine yourself at home. So is it possible that that number is a little higher or much higher than what they're saying? We're standing today at how many, I think I forgot the number today as it stands. I don't know if it's 120.
We are at 133.
133.
Yes, I think the true number is actually higher than the reported number. Okay, but having said that, the pattern still applies, like the pattern wouldn't change. So even if the numbers are higher, we really have like 4 deaths so far, and 2 of them, like we know the exact details, and they were not due to like the coronavirus itself causing the death. So, so I think we are still doing okay. The hospitals are not flooded yet. We just built actually like a COVID hospital, not built it, but we refurbished an entire building at AUB-MC to be like the COVID building in anticipation of our HUH getting full, and then we can start to take some cases at AUB-MC as well.
I think many hospitals are probably going to start adopting that as it comes through.
I hope so, because we will not be able to deal by this all by ourselves, definitely. We started testing at AUB-MC, and you will probably notice that the numbers will become a bit higher going forward, because now the test is available for other hospitals as well.
Doctor, is there, nobody really knows, you had said, how long we should be quarantined for, but is there a possibility that this will ease maybe as summer comes in or the weather gets hotter, maybe May, or is there any truth to that this virus does not survive or it mutates in the heat?
So this is a very interesting question, Youmna, and the straightforward answer is, again, we don't know.
We don't know.
But there are some speculations that this virus might actually be heat resistant. Let me give you some example. The MERS-CoV, which is also from the coronavirus family, and it caused a little pandemic.
Excuse the constant electricity here. For everybody watching, we're in Lebanon, but we're on 3G, so we're still going strong. Go ahead, Doctor.
Yeah, we can still see you well.
Yes.
So MERS-CoV that also caused a lot of deaths in Saudi Arabia actually happened in August, in the middle of the heat.
Right.
So the coronaviruses are probably not that heat resistant. The other thing is that we have a lot of cases in the UAE and in the Gulf now.
Mm-hmm.
So had it been heat resistant, you wouldn't have seen that same exact spread.
Right.
We still need to see if this virus is indeed heat resistant and the cases are going to slow down in the Northern Hemisphere, then we expect them to actually become higher in the Southern Hemisphere as the weather becomes colder.
Right.
So we're really still not sure about the fact that it's heat resistant or not.
Before we get to, you know, thanking our help and our support and the doctors and the Red Cross, I just want to talk about the latest information we got when it comes to how long this virus can survive on surfaces. Because I know you and I were talking and we said that we thought it was a specific amount of time, duration, and now we know it's something else. So can we just go through that again? How long does this virus survive on surfaces, which is one of the main ways of being infected and contracting this disease?
So it is one way of getting infected, Youmna. It's not one of the main ways. Okay.
One way, right?
Yeah, one way. So again, the main way of getting infected is to get in touch with someone who is actively infected, so confirmed COVID-19, and who coughs or sneezes in our face. Okay. So droplets are the major and the main mode of transmission. Now, if you touch a surface that someone with an infection had touched, and you put your hand on your face, so on your mouth, on your nose, on your eyes, you might get infected. How long exactly does this virus live? Again, there are different reports that are coming out. Actually, every day we have a new report coming out about the life of the virus on surfaces. Now, some people say that it lives for 24 hours on cardboard. It lives for a few hours on stainless steel. Some people are saying that it can actually live up to 9 days on certain surfaces. Now, we have to keep this in mind, is that all these experiments were done by taking an aliquot of viruses, pipetting it onto a surface, and then wiping it, and then studying how long the virus lives, which is not how it happens in reality. Because in reality, you're actually like coughing or spreading your droplets on a surface. And it comes with other enzymes and, you know, other stuff that your body secretes as well. So we are not 100% sure that about the lifetime of the virus on the surfaces. We know that it does not die immediately. Mm-hmm. We know that you only get it this way by touching a surface and touching your face. Right. And we know that with disinfectant, you can actually eliminate the virus from the surfaces.
All right. Doctor, one question we got before we conclude this is food and the safety of food. And then we'll get to your question, Dana, in a second about whether or not it's airborne. Raw vegetables, sushi, uncooked meat, because cooked, we know that I think it takes away any chance of virus. This is people and doctors and researchers have warned us against raw and uncooked meats. What about vegetables and sushi for our sushi lovers in Lebanon? Yeah.
So I think we have a lot of reasons not to eat sushi nowadays in Lebanon, other than COVID-19.
Yeah. Right.
But I want to go back to the to the subject. So unlike hepatitis A and other viruses that are transmitted via the fecal-oral route, this does not seem one of the main ways of COVID-19 to be transmitted. So we don't think so far that COVID-19 is transmitted through food. But again, this is what it stands now, and this is how it stands now. And I don't know if this is going to change in the future, but the CDC and the WHO and all these reliable sources say that this is not one of the main modes of transmission of COVID-19.
All right. There's been talk about the virus being airborne. Can it survive in air? Is that something we need to worry about?
So now there are some reports that are questioning whether this virus is airborne, but I really don't think so. The droplets are bigger than it allows them to be suspended in the air, and they really have to come out on your face or on a surface or on a mucosa in order to cause the infection. We don't think that it's an airborne disease like tuberculosis, for example. But this is what we know so far.